I'm really delighted to have a conversation now with Jessica Malaty Rivera, who is really one of the heroes in science and public health communication. And we're going to be having a conversation about all things that you wonder about. And we'll also have a chance to address some of the questions that you have, and look forward to having this conversation. Jessica, great to be speaking with you again.
Thanks so much for having me, Tom. I'm happy to be here.
Well, let's dig right in. And as people are joining, just to say that this is one of a series of conversations, and we're trying to put more facts into the world that we live in, because we're living in a world which is unfortunately sometimes devoid of facts, or actually being populated by fictions. So one of the big issues is on vaccines, and we've seen a lot of developments over the past year. We've seen, though, a lot of real progress with the understanding that, hey, actually, anti-vaccine rhetoric is not highly popular with any group of voters. Nevertheless, we are seeing more skepticism. We're seeing lower vaccine rates. And Jessica, you do tons of public communication. So let me ask you a tough question, which is, what are some of the toughest questions that you get about vaccines?
Yeah, it's many of the circulating narratives and the rumors about vaccines are not new. They have persisted in the public for quite a while, and they are usually related to topics that are very sensitive. So you're always going to hear things that make people feel insecure about their fertility, or about their genes, or about their proclivity to more infections, and the big C word, cancer. Those are very common themes that we see attached to new vaccines or vaccine policies that make people feel uncomfortable. And part of what I do is to help people recognize those themes, that you may not actually be seeing new information that might be connected to this new vaccine or this new policy related to a vaccine. You're probably seeing something regurgitated from the past, and helping people identify those patterns can be a way to give people a little bit more what I call infodemic resilience. So a kind of stamina and agility to manage what could be just constant disinformation, or questions that are actually more problematic than helpful. What I fear is, now that in this Mahaification of the vaccine dialogue, what is being presented as just asking questions, or just trying to get gold standard research, evidence-based research, they're presenting this pursuit of making America healthy again as this altruistic, virtuous way to answer questions that haven't been asked before, which really is an insult to the years and years of science and scientists who have worked to answer these very specific questions. It makes it sound like we've not done our due diligence, and that's just the farthest thing from the truth. And so when people are saying hasn't been rigorously studied, it was only studied for 4 or 5 days, this common trope about the hepatitis B vaccine, I try to help people zoom out and say, that's actually not true. Let me actually show you the evidence. Just because somebody says it confidently and loudly doesn't make it true. And I feel very defensive of the science in that sense, because to come in, saying we're just asking questions, but you've also already answered the questions about these vaccines and you're presenting them as facts, just feels very insincere from a public health standpoint.
Yeah, I mean, from where I sit, it's really striking, because I oversaw the ACIP for 8 years, and it really was the gold standard of evidence. You looked at everything transparently, you published everything, really rigorous. If you could go back and do anything differently, you'd communicate a little better, because it didn't really explain the decisions that were being made. But the irony of the disconnect between what they say they want, gold standard science, lack of conflict of interest, and what they're doing, which is infusing conflicts of interest and undermining science, could not be more stark.
Yeah.
A lot of that is driven by money. How do you talk about that? How do you talk about the influence of money on misinformation, disinformation, litigation, whether it's, hey, we're going to sue the Tylenol manufacturers, so why don't we so doubt that Tylenol causes autism? And even if pregnant women end up with fevers that damage their babies, we're not worried about that because we're going to get rich from it.
Yeah. I talk about this a lot because, as you can imagine, as somebody who is a public health communicator, I get accused a lot of being bought, of being a shill. And I've, probably to the detriment of my bank account, have very much not been that type of communicator or influencer. I have made it very much my whole brand to never be paid by pharmaceutical companies or vaccine manufacturers, because I want people to understand I'm actually saying this from the evidence and not from the paycheck, that I am an unbiased, informed voice for folks to make those choices. And I try to say, well, if you want to talk about the money trail, let's talk about the money trail, because it is very, very clear. It's so easy to debunk the claim that doctors get money from vaccines. It's so easy to show that when you compare the profit margins of the wellness industry, which is very much connected to the vaccine misinformation industry, we're talking about what almost feels like a David and Goliath scenario. Trillions with a T of an unregulated, unsupervised industry that sells potentially harmful, oftentimes meaningless interventions, versus a highly regulated industry, which I am not saying is not about profit. I am not here defending pharma by any means. But if you compare the two, you're talking about truly completely non-comparable industry impacts. And then you look at kind of the people involved, the ambulance chasing effect that was prior to RFK Jr.'s tenure as HHS secretary. And there was a lot of money to be made by suing vaccine manufacturers. There was a lot of money to be made when you aligned with certain interest groups and lobbying groups. I mean, I'm thinking even just specifically about the nutritional guidelines that were just updated. And you look at the people who were involved, the groups that were involved, and it was big ag, it was big dairy, it was big, poultry and meat lobbying groups. You cannot separate the money from this conversation. And when you actually look at the receipts, which are publicly available, it becomes abundantly clear what is actually bought and what is not.
Yeah, there's a difference between profits and profiteering. And let
Yes.
me also say that neither I nor Resolve to Save Lives take any money from any pharmaceutical or manufacturing industry, never have, don't now, never will,
Yep.
for the same reason. We don't want there to be even the appearance of conflict of interest. One of the real challenges that we have is that expert has become a four-letter word.
Oof.
And,
Yeah.
and one thing that I try to emphasize in my communication with public is that you are the expert in you. But when it comes to scientific questions, there are people who really know a lot about this, and
Mhm.
let's listen to that.
I mean, the death of expertise is a condition in this country, and also the rise of armchair expertise. If you're loud enough and popular enough with enough followers and enough sponsors for your podcast or for your platform, you are elevated as somebody who is believable and credible, which is an insult to the folks who spend years and years through very rigorous training to get those credentials that make them the actual expert. Now, I'm not saying that hierarchy of degrees is the only thing, because we've seen people who've come out of very prestigious institutions be some of the worst proliferators of harmful health misinformation. It doesn't matter that they went to this university or this, university.
And conversely, we have people who don't have advanced degrees who are brilliant and excellent at
Absolutely.
understanding and explaining things, but it requires really deep knowledge
It
of
does.
the topic.
It does. It does. And it also just feels like, just very antagonistically focused on public health science, where the distrust is focused on. I mean, I'm not checking the credentials of my pilot when he's flying the plane. I trust that because he's the expert, he or she is going to fly the plane successfully, right? I'm not going to question my chef at the restaurant from being able to cook my food to my liking. I'm going there because I believe that there's an expertise behind the door. There just really feels like, because of the politicization of public health, that the undermining and the kind of credential checking and even just the expertise doubting that is happening feels like a revenge tour to me, Tom. It feels very much like, well, you were responsible for something that was really frustrating for me, an experience that was really traumatic for me. How can I make you pay for that? That's what it feels like.
Let's stick with that for a minute. We're now 6 years after the emergence of COVID, and we're not ready for the next pandemic, and we haven't come to terms with what went right and what went wrong. One of the things that we at Resolve to Save Lives do is to advance an approach called 717. That every outbreak should be found in 7 days, reported to public health in 1 day, all control measures in place within 7 days. And more than 80 countries are either using or considering that. And we're seeing it as a way of both improving preparedness, so we're finding faster, stopping sooner, and giving some accountability. But big picture, we haven't come to terms with COVID. We've still got kind of a COVID hangover. And we're, for all the debate about lab leak versus spillover, we're at risk for both. And we need to address both globally. So it feels like, although kind of we hoped during the height of COVID, oh, this is going to really accelerate global preparedness, it may have actually set it back.
I fully believe it set us back. I fully believe that the trauma experience of the COVID-19 pandemic has regressed our collective preparedness and resilience to the era of pandemics that we are in. Even as the pandemic was happening and we were trying to illuminate the connectedness of climate change and pandemic viruses of pandemic potential emerging, and antimicrobial resistance and the potential harm for public health. I mean, people have been oversaturated. They don't want to hear it. And I think that this is where ignorance is bliss is kind of replacing a lot of sense in the public, where they'd rather say, well, it's up for debate how and when it actually happened. It's up for debate. I mean, if you go to covid.gov now, you're going to be met with a completely conspiratorial website about the lab leak theory. And then if you scroll down far enough, it goes back to what I was saying too. Again, it's a revenge tour. People want a villain and they want somebody to blame for what was a collectively difficult time. And I think, Tom, you and I probably have higher frustration or stress tolerances for something like this because we've been preparing our whole careers for moments like COVID-19. The average person does not. But this is why I feel so strongly about resilience, because there will be another one. And how do we get people to be prepared for both the biological impact and the information impact of a new threat that will likely happen in all of our lifetimes? It's not a necessarily just once in a century type of scenario here, as so many confounding factors accelerate us to more threats, more biological threats. It makes me very nervous that the next one will blindside us.
That ties into global health. And of course, that's what we do at Resolve to Save Lives. We work with more than 60 countries to prevent cardiovascular disease and epidemics. I understand you've been doing more work outside of the US. Tell us about what you've been doing, what you've been seeing, and what your impressions are.
Yeah, I got my interest in public health in global health. I wanted to understand. I realized as I was a pre-med student that I was far too sensitive for the clinical side. I just had too much of a bleeding heart to see people suffering. I thought, well, how can I be involved in the preventing disease in the first place and health promotion in the first place? And so it took me all over the world. I've been to over 50 countries at this point working on global health stuff, and I love it. And I also love the fact that it helps me connect the story of public health in the U.S. because global health security is national health security. It is so clearly connected because a threat over there can be a threat over here in a matter of 8 hours, one flight, one person on one vessel who crosses a border, because last I checked, pathogens don't care about borders, right? They just look for hosts, and hosts are everywhere. And I try to show people the interconnectedness of global health and how when we reduce harm and reduce the burden of disease, and we reduce poverty even, and give people more access to vaccines and clean water and maternal child support, we can protect Americans as well. We can show that harm reduction there is harm reduction here. And I feel that so strongly because we know that with the introduction of the last several consequential disease outbreaks that we've had here, it's involved some sort of importation. And that's not to say that it couldn't even emerge here. Diseases have certainly emerged here as well, but we don't live in isolation. Public health at its core is about community, and the global community is really an integral factor when it comes to talking about how we can improve the lives of Americans. We have to be thinking about other countries. That's why it's so devastating to see what's happening at USAID and PEPFAR. Those things directly harm Americans. And I try to tell that story. I try to say, look, I was in South Africa looking at the incidence of TB, and I live in San Francisco. There was a tuberculosis outbreak at a high school here a few months ago. I'm trying to connect these dots and say, again, a disease over there can be a disease over here in a matter of hours. And so we cannot try to think that we are alone protected.
Yeah. And I think what we're seeing is the start of a new era in global health. The first quarter of this century was a golden age, and it was bipartisan. Actually, the biggest program by George W. Bush, the PEPFAR, big success story, and it's over. I mean, there's still substantial assistance and important programs, but we are in a different phase now, and that's going to require a different type of partnerships and a different type of action globally. And misinformation is one of the biggest threats to global health because it undermines not just vaccines, but all of our public health programs and our health programs.
Absolutely. I lived in DC for 8 years, and I've been to DC more times than I can count since I moved away. And I've gone on behalf of UNICEF, on behalf of the United Nations Foundation, and a number of organizations that are seeking to provide these resources that are so life-changing and so transformative to children and families all over the world. And I have seen a massive shift from what used to be a very purple issue, very purple. You just saw bipartisan support almost without question, to now a very, very split conversation. We are talking to lawmakers on one political side will argue in defense of efficiency and argue in defense of America first. And I keep trying to remind them that America first thrives when the world thrives. That when we create these diplomatic holes, the soft diplomacy of US aid, and also these public health holes of defunding things like PEPFAR, that we make ourselves weaker and more vulnerable. And I've actually heard from the mouths of some of these lawmakers a shrug or if our adversaries fill those holes. I had one lawmaker tell a group of folks that I was on the Hill with, say, let them. An unbelievably self-sabotaging perspective that is just so vitriolic because we've become so polarized that it's by any means necessary. The red team needs to win or the blue team needs to win.
And global health is not a zero sum. When other countries are healthier, we're safer, our economy will grow more. So there is a real common interest, and we hope that will be seen increasingly in the future.
I hope so.
One of the real challenges in science communication is explaining change. Guidance changes, knowledge changes. In fact, one of the people who I was privileged to learn from was George Comstock, and I tell the story in the book I published, The Formula, but it's really striking. Comstock was the world's expert in tuberculosis, and he and I both wrote editorials in a journal, and he said more studies are needed on a particular question, which was actually the prognosis of a positive tuberculin test over the lifetime. And I was so puzzled because he had done those studies, classic, brilliant studies. So why was he calling for more studies to be done on it? And when I asked him, he said, this is the person who kind of knows more than anyone in the world on this topic. He said, well, of course we need to study more. The bacteria might have changed. Our immune system might have changed. The dose, the inoculum might have changed. Unless we study it, one won't know. And so science doesn't give certainty. Science gives humility. And yet, coming up against an armchair expert who gives you a simplistic answer, and this is the answer, and we're sure of it, and this is going to cure you or kill you, science has a hard time explaining.
I mean, you took the words almost verbatim out of my mouth from a conversation I had with a friend this weekend about the difference between certainty and humility. That I am a scientist because I'm endlessly curious, and I'm not trying to find absolute truth. I'm trying to find consensus. I'm trying to find reproducibility. I'm trying to find a overwhelming amount of data, because the way we ask our questions, we're not there to prove false negatives. We're not there to have a 100% certain answer. It's an extremely iterative process, which is why from the very beginning of my public science communication effort, I introduced folks to the discomfort of not knowing. And I said myself, I don't know a lot. I also said, we don't know, or it might change. So walk with me through this season of evolving information, because your timeline is just as fresh as my timeline. I'm learning in real time in this emergency. And I think that that's where scientists feel a little uncomfortable and the public feels a little bit uncomfortable. I think for the longest time, expertise was synonymous with certainty. Expertise was synonymous with infallibility, and that you just had the answers, and it was very binary of 0 and 100. And last I checked too, harm reduction is not harm elimination, it's reduction. So you have degrees of risk and harm that people have to be comfortable with. And there has to be degrees of uncertainty and waiting that people also need to be uncomfortable with too. So inviting people into the process of change, of we're still learning, learn with us as we go, and be patient with us if things change. We've done sentiment studies in the work that I do, Tom, where we've asked people, where was the moment of breaking trust? And a lot of people will say it's when the policies changed. You dig deep into that, and people really hold experts at a high standard. And so when it changes, and it should change, right? Because the data are evolving, the way it's talked about is where the moment of truth happens. It's if we can invite people in okay, look, this is what we knew, this is what we know now, and this is why we need to change it, and this is how it affects you, is a much better way to be like, we no longer think this, now we think that. You got to include people in that process.
Let me ask you something. Just stepping back, looking back to exactly 6 years ago, CDC was silenced. Before CDC was silenced, actually, Nancy Messonnier got it exactly right.
Mm-hmm.
Right? She kept saying there's a need to be humble. This may change based on what we know now. Here's what's important. And when CDC was silenced, what got lost was the ability to bring the American people along on the path of discovery, to say, listen, what we know now is this. It may change. We'll tell you what we know. We'll tell you what we don't know. For what we know, we'll tell you how we know it. For what we don't know, we'll tell you what we're doing to try to find it out. And as we learn more, we'll share that so that people could kind of walk the path of discovery together. Do you think that if that had changed, if the CDC hadn't been silenced, we might be seeing a very different narrative today?
100%. I mean, the reason why the COVID tracking project, which I helped lead, a mostly volunteer organization that stemmed out of the Atlantic magazine, was because we were just not seeing what we wanted to see from the CDC. And part of that was not their fault, right? It was very politically motivated. Part of it was the kind of chronically underfunded condition of CDC and the kind of volume of data analysis and data communication that was required of that time. But one of the issues here is kind of the consequence of how our Constitution is written, right? Public health has always been a state issue because of federalism. And so some states really adopted a communications forward approach. California really shined in that way. I saw public health leaders in the San Francisco County.
Ohio did too.
Ohio did. Hawaii did. There were a number of states who said, you know what, we need to be the messengers for our jurisdiction, and we're going to take responsibility for that. But man, was everybody looking at the CDC as the North Star in that moment? Absolutely. And would it have changed things if they were on the same page as the local leaders and aligning messages and even embracing the uncertainty of the moment? It would have been so different.
One thing, let me ask you about the issue of certainty. I've suggested that we think of things in 3 or 4 categories. One category where we're virtually certain. We're never going to find out that smoking cigarettes is good for you. The other is that it's highly likely that this is right. But as scientists, we need to be humble. And, there are things that I was taught in medical school. If you I'll give you an example, beta blockers to a patient with heart failure, low output heart failure, it's malpractice. That's what I was taught in medical school. Today, you'd be taught, if you don't give beta blockers to a patient in low output heart failure, it's malpractice. So I mean, there are things that seem likely, but they might change. Then there are things for which there's some evidence. There's at least one well-done study, but it could get flipped. Currently there's increasingly strong evidence, for example, that the shingles vaccine prevents dementia.
Right.
The evidence is pretty good, but it could certainly be flipped. So I think this idea of having some range of confidence in the conclusions that we're drawing, and to be frank about it, we're certain of this, and this, I'm certain that if you keep your blood pressure really healthy, under 120/80, you're much less likely to die young or get dementia.
Yeah.
I think if you keep your LDL under 70, the same thing will happen, but that's much less certain. So I don't know
Mhm.
how we kind of give gradations of certainty.
There is an insatiable appetite from what I've seen on social media for science and health content. It's a primary news source for a lot of people. They are following influencers and creators who are extremely loud and opinionated about health issues. And so when we are going to people where they are, which is social media, and explaining to them that, you know, uh, when somebody is making a claim, an extraordinary claim, they need extraordinary evidence to back that up, right? So people will make these claims of like, well, this has just not been studied enough. And I'm trying to ask people to like zoom out a bit and say, how long has this vaccine been around, right? You can say that since it's been around, there have been continuous observational studies from the public, from population level data, to show that it has continued to be a safe and effective intervention, right? People don't want to see that because they're going to just think very myopically about the topic. They're going to repeat the talking point of the person that they heard this like wild, extraordinary claim from. And so I feel so passionate about helping people understand bigger picture when it comes to how things are designed and when change happens and why change has happened. But there's also just some very strongly held biases about some topics. We've actually asked the public, which vaccines feel trustworthy and which ones don't. And one of the research projects that we did showed folks would basically have an unscientific categorization of old school vaccines versus new school vaccines. But where they drew the line was all over the place. Some people, based on their age, drew it at varicella. Some people drew it at HPV. Some people drew it at COVID-19. And so we just kept asking too, we said, is it longevity in the market? Is it the number of people who have received the intervention and the totality of adverse events that you have seen on VAERS? It is extremely subjective. And I try to show people like we can all come into any conversation with our biases based on our risk tolerances, based on our medical history, based on anecdotes, which are extremely powerful. But helping people understand that the evidence from 10 years ago could be the same as what we have today. It could also not be the same. And the fact that it changes is not the problem. The fact that we're not communicating about it the right way is.
And the other problem, and we're going to run out of time, so just one more question for you. But first, to comment that we have such a challenge. It's so much easier to spread lies than to correct them. So when RFK Jr. recorded his 3-minute video for Gavi and said, oh, there's a study that shows this vaccine increases the risk of death tenfold, it took me 2 days to find the study, read it carefully. The methods were a mess. Reanalyze the data, figure out where the mistake was. And this is an invalid study, but it also hasn't been debunked because nobody gets tenure for debunking studies in the medical literature. So let's end with this. We know that money is driving much of the misinformation. It's the monetization of misinformation.
Yeah.
How do we reveal that? How do we unveil that? How do we call that out and use that as a way to explain the way forward?
Yeah. A lot of it, I think, is how we talk about it. I have moved from saying things like the anti-vaccine movement, and I've started calling it the anti-vaccine industry, because it is an industry. It is a profitable market. It is a profitable business model where a few people who have a vested financial interest in either selling alternative solutions or getting people to subscribe to whatever regimens that they're on are poised to make a lot of money off of people's distrust in traditional allopathic care. And I want people to understand, if folks are actually thinking about harm reduction, making America healthy again, and also taking out conflicts of interest, I want to actually expose those conflicts of interest as explicitly as I can by showing that David and Goliath effect. You're talking about an unregulated, unmanaged, kind of wild, wild west of health and wellness versus a highly regulated industry. And I think that when there isn't the types of checks and balances, like you said, it's going to rely on independent science communicators, researchers like yourself, career scientists who've been doing this, to do this extremely time-consuming work of exposing the lie. It's so easy to just say something confidently and believe it as fact. We saw RFK Jr. do that multiple times under oath. just repeating falsehoods without any type of checks and balance, because we know it's part of a strategy, Tom. Like, this is part of a way to create memorable and repeatable content so that more and more people get indoctrinated in the mistruths.
So we need to reveal that they're selling stuff, they're selling subscriptions, and they're suing.
And they're suing.
Selling, subscribing, and suing. The three S's.
That's it.
That's their business model.
Yeah.
And that business model preys on misinformation, disinformation, and risks the health of Americans and people all over the world. So, Jessica, thank you so much for what you do to stand up for facts, fact-based conversation, listening well, and conveying the important things that will help people live longer, healthier lives. Thanks for what you do.
Thank you, Tom. You as well.